Hi, welcome everyone to this episode of Q&A. We're going to cover a few subjects. So let's just dive in. Dr. Shen, first one tonight is common treatment methods for the different grades of prostate cancer. We hear this all the time. Everyone struggles with this. Can you talk about that?
Absolutely. So I think if we're talking about localized prostate cancer, or potentially curable prostate cancer, the bottom line is there's two treatments. You can either do a surgery-based approach or a radiation-based approach. Um, but depending on the grade of cancer or stage of cancer, um, within each of those avenues, the treatments can be different. Now, the basic surgery for prostate cancer is fairly uniform regardless what stage of cancer you have. And regardless what stage of cancer you have, surgery is an appropriate option. However, the worse, for lack of a better term, or like the more higher grade or higher stage of cancer, the surgery itself may be a little bit bigger, if you will, less nerve sparing, and also associated with higher likelihood of recurrence and perhaps needing radiation after that surgery. But for any stage of cancer, um, uh, the surgery is one option. And the other option for any stage of cancer is going to be radiation. And within the radiation pathway, depending on the stage of cancer, the radiation could be radiation by itself. It could be internal radiation, external radiation, or a combination. And it could be accompanied by hormonal therapy. Hormonal therapy makes the radiation more effective, and the longer duration you go on the hormonal therapy, so whether it's 6 months or 12 or 18 or 24, the longer duration you go, the better the cancer control rate. So how does one pick, right? There is a balance between what sort of side effects you're willing to put up with and what sorts of cure rate you're wanting to achieve. So if a patient has, for instance, high-grade cancer and wants to achieve a very, very high cure rate, the highest possible cure rate, you would do, both internal radiation, external radiation, and hormonal therapy for a long duration. But for some patients, they are more interested in quality of life. And they might say, you know what, I'm willing to accept a good cure rate, maybe not the best cure rate, but good cure rate for better quality of life. Maybe that's decreasing the duration of hormonal therapy, maybe only treating with one modality of radiation. And so these are the decision-making steps, right? That the doctor and the patient works together on to figure out what makes the most sense for each patient. So when I talk to patients, I actually spend most of the time, or much of the time, figuring out what's important to them, so we can sort of tailor these treatments to what makes sense for each patient. There are certain things that just don't make sense, right? Doing like extremely aggressive treatment for something that is a very low grade cancer that has, a very high probability of cure with just one type of treatment. And there's certain national guidelines that kind of give guideposts on what sort of treatments are normal or expected for each type of stage of cancer. But the basic gist of it is that for any stage, you have either surgery or radiation, and within radiation, you can be a little bit more aggressive or a little bit less aggressive.
And this is something I think just about every single man has questions about when they come to our group. And one of the things that I think has been really helpful over the years that we've kind of refined is it's the hardest time in your life to slow down, but maybe the most important that
Yeah.
you think you have to urgently do something. You do have to do something, but you don't have to immediately do it. What is so important is to get comfortable with what you've chose and who you're going to let do it, and then once you've done that, then you just put all your trust in and you never look back. There's no do-over. So
Yeah.
you don't go the rest of your life second guessing anything.
Yeah.
It's something I think is really important too.
No, I think that's a really great point. I think it's very important. Even with, well, a lot of people when they get diagnosed, they have been diagnosed with cancer, and it's a very scary moment, even if it's a lower grade cancer, and because it's just that word, a cancer. And so there's this like kind of rush internally and say, oh, I gotta get take care of right away. Prostate cancers, even high risk prostate cancers, they don't grow that fast. And you'll hear me talk about this, or the urologist will talk about this. Taking a couple of months to figure out what you want to do will not impact on the cure rate. And so it's, it's something you really want to really figure out what you want to do, because there's so many different options and so many different ways that the future looks like. And how it affects your work and how it might affect your family life. I think those are really good things to figure out before one, commits to one particular treatment.
Yeah, thank you. Okay, this is from a guy who had BPH all his life,
Mhm.
and now the prostate cancer treatment doesn't have BPH. Does he have to worry about that
Yeah,
coming back?
yeah. So, that's really interesting question. And so BPH, right, benign prostatic hypertrophy, comes from enlargement of the prostate glands. Okay, prostate glands. And so typically, if you do just radiation by itself, that's not really going to shrink the gland at all. Um, but what happens sometimes is how it goes away is some patients, when you do radiation, you combine it with hormonal therapy. And hormonal therapy is taking away the body's testosterone. Okay. And that is kind of like a supercharged version of many of these medications for BPH. The common ones like Avitard or Proscar or finasteride, those medications cut your testosterone in half, essentially. Well, hormonal therapy cuts it down to almost zero. And so the prostate shrinks. Um, so after the treatments are over, um, the prostate may get back to its original size a little bit. It may get a little bit bigger. But over time, the benign glands are going to be affected. It's not going to keep getting bigger. So that's a long way of saying, you know, um, it may stay better indefinitely, but you may also uh, get a little bit more side effects from the treatment itself, and maybe hard to tell what's BPH side effects and what's radiation side effects. Um, for the patients who have BPH going into radiation, we know they already have some urinary problems going into radiation. And so those patients also have a little bit higher risk for getting radiation, getting urinary problems after radiation. Um, so long way of saying it'll get better, on the hormonal therapy, but it won't be a lot better, and it may go back to the way it was before.
That
Um,
explains though why it's going away for these guys. That's really
yeah,
useful.
yeah. And of course, like, in the long term, this is kind of a little side note, but interestingly enough, in the long term, if you do a biopsy of the prostate, way after treatment, much of the time there's no more glandular tissue. Like the tissue is um, the stuff that grows, that enlarges with BPH, won't grow anymore. So you're going to be stuck at the size you're at. May not shrink, but you're not going to keep growing. And so I think the symptoms will stabilize after treatment.
Okay. Here's another common one. This is a great question. I'm so glad this one got submitted. The guy's having a hard time focusing after his radiation. He's in the middle of his hormone treatments. What does he do?
Yeah, that's a hard one. That's a hard one. It's because there's two different ways, two different reasons why you have a hard time focusing. One, radiation itself is going to cause fatigue. We don't 100% know why it does this, because why, if you treat this little portion of the body, right, with some radiation, that your whole body feels tired, but it does. And I think part of it is the radiation is causing some cytokines to be released, some hormone chemochemicals to be released. When I say hormone, I don't mean like testosterone hormones, different cytokines, and growth factors, or signaling factors that cause release. That basically says your body is sick. It's like how you feel when you get a cold. You get a cold, your whole body feels sick. It's because your body is releasing these different cytokines, these signals that saying something's wrong. That's part of it. The other part of it is the hormonal therapy itself. you don't have testosterone, and you just feel tired and you can't concentrate because of not having testosterone. That is a known effect of not having testosterone. Okay, so what do you do about it? It can't give you back testosterone because that's the whole point of the hormonal therapy. And so the only thing that's been shown to help with these symptoms is exercise, diet and exercise, but really the focusing on the exercise. That's been shown to help people feel better, concentrate better, feel more energy, less tired, and that will help things. It's not easy, right? Because, you know, none of us find it easy to exercise, but the more you do it, it's like a positive feedback loop. The more you do it, the better you feel.
Yeah, and I found that, with cancer treatments, and just around prostate, it's so much once you decide what you're going to do. So you go through all those steps, then you decide what you're going to do. You're going through it. Now it's pretty much out of your control. You just kind of you sit back and you take your treatment. But when it comes to your choice on whether to exercise and change your diet a little bit,
Yeah.
that is in your control, and it's
Yeah.
really an empowering thing. The people that do it, I've never heard anybody regret it.
Yeah.
Everyone is happy that they've made some kind of incremental improvement, and we know that it will affect their ability to deal with these side effects. And I think long term, I personally, I think I'm going to live longer because I got prostate cancer because I stopped smoking and started exercising. I credit that intervention. So here's another one. Physical therapy
Yep.
and prostate cancer. Um, who would benefit?
That's a great question, right? Because I think in some ways anybody, right? Like, so there's different ways, and when we say physical therapy, I think of different parts of physical therapy. So like just like there's different types of doctors, right? There's different types of physical therapy physiatrists, one part of this physical therapy is to help with conditioning, deconditioning. So as people are on hormonal therapy for a long time, especially, their body's deconditioned. They don't um, their muscles are not as strong. They're just not don't have the same exercise capacity. And so I think some of the classic physical therapy that we think about, like helping people do some exercising, strength training, building up their muscles, that's all very helpful, especially for some folks who've become deconditioned on hormonal therapy or other types of treatment. The other type of physical therapy, which I run into a lot, is pelvic floor therapy. This is a very specialized, you know, portion, of physical therapy. Um, this is really important. People who are having uh, uh, um, somebody's urinary side effects from radiation therapy or pelvic side effects from radiation therapy or hormonal therapy, or surgery, can really benefit from these folks. And what they kind of do is they help tighten some of these muscles in the pelvic floor so that if you have leakage, the leakage stops. Or if you're having difficulty urination, sometimes that can help. Or maybe, with different discomforts and pains and whatnot, I think physical therapy in the pelvis can be helpful. That said, sometimes it's kind of a commitment to go to another physician or another a specialist, I should say, to go through these treatments and to learn how to do these exercises and to consistently do them. But in general, I've never regretted sending a patient to physical therapy.
So ask your doctor for help, and you can help. Doctors
Yeah.
can help people navigate to the next specialist.
Absolutely, that's exactly right. So like, look, if somebody's feeling 100% normal, they don't have any problems. I don't think those folks need to see a specialist just because.
Right.
But if you're having leakage, if you're having some discomforts, I think physical therapy and maybe you've tried some stuff on your own already and nothing's really helping. I think referral to physical therapy can really be a really, really great solution. And very, very frequently it will get good results.
Well, thank you so much for these insights, and everyone who's listening out there. I hope these were helpful. And if you want to pay it forward, and these were helpful to you, then I bet you have a question that others would benefit from. So go go on ahead and submit them on our forum at Prostate Network Q&A. And I wish everyone all the best. Our meetings are always first Wednesday, 6:30 p.m. Central Time. If you're in Kansas City, you're obviously welcome to join us, but an iPad will work just as good. So I wish everyone happy holidays, and I'll see y'all later.
Take care. Thank you.